Hi, for my disease presentation, I chose to do syphilis, which is caused by the bacterium Treponema pallidum. So, syphilis has three different stages marked by different signs and symptoms. The first stage begins after an incubation period that can vary from 9 days to 3 months, but the average incubation period is about 3 weeks. The first stage is characterized by the appearance of a sign that's known as a chancre. This appears as a small, hard red bump. It shows up at the site of entry of the pathogen. This is either a mucous membrane or abraded skin where the bacteria was able to get a foothold into the epithelium. Most appear on genitalia, whether that is internal or external, but 20% do show up on the lips, oral cavity, nipples, fingers, or around the anus. So, again, this can be any mucous membrane or abraded skin. It starts as a small, red, hard bump, but then gradually progresses and eventually breaks down to leave a shallow crater with firm margins. And the base of this crater contains the bacteria that are multiplying. These are totally painless, so it's easy to miss them, and they heal spontaneously with no scarring. So it's very easy for people to go the entire phase, the entire primary phase of syphilis without even knowing that anything is going on. They do take 3 to 6 weeks to heal, so there's a fair amount of time that they could be noticed, but they are painless while they're there, and they heal spontaneously with no scarring. That might sound like a good thing, but when the chancre heals, it does mean that the bacteria have escaped into the circulation and are now multiplying and proliferating in circulation and systemically. So at the end of the primary stage is when the infection progresses to systemic circulatory involvement. So, secondary syphilis begins about 3 to 6 months after the chancre heals. This has given the bacteria enough time to move through the body and proliferate so that many body systems are now involved, and the signs and symptoms associated with secondary syphilis are much more profuse and intense. The first symptoms of this stage are very general, common systemic symptoms such as fever, headache, and sore throat. So these are very easily mistaken for some other infection, even like a cold or the flu. Sorry about the sirens. um, so after that come the more secondary signs, later parts of secondary syphilis. These include lymphadenopathy or enlarged lymph nodes, a red or brown rash that can affect all skin surfaces, but most distinctively in syphilis, it appears on the palms of the hands and the soles of the feet. There's no itch or pain, and it can last for months, but it does contain viable bacteria, so that's another way the bacteria can be spread is through an open lesion on a rash. And hair loss is also another symptom of secondary syphilis. So these are all kind of general symptoms, again, that go away after a while. If you are not health conscious, it would be very easy to miss this secondary stage of syphilis as well. However, unfortunately, this stage is marked by major complications starting in the bones, hair follicles, joints, liver, eyes, and brain. And these complications can linger for months or even years after secondary syphilis has resolved. So after secondary syphilis, About 30% of syphilis infections enter a latent period. This period can last for 20 years or more and is totally asymptomatic. So if you either didn't notice or didn't think primary and secondary syphilis were a concern, it would be very easy to think that they were just some weird random happenings and now you're all better. But that is not the case. At this point, the bacteria is latent, so not producing any symptoms, not causing any damage. It cannot even be detected in the blood. So if you take a blood sample and look for the bacterium itself, you won't find it. However, you can visualize antibodies at this time. If you take blood, test them for antibodies to T. pallidum, they can be found and identified. So it is capable to diagnose syphilis at this time, but given the lack of symptoms and the difficulty in diagnosing it, it's uncommon to have this be the stage in which syphilis is diagnosed. So following the latent period comes tertiary syphilis. This is relatively rare thanks to antibiotics, modern antibiotics, penicillin particularly. But when it does occur, it's very damaging, causing lasting, long-term bad effects, and it can even be fatal. So it shows up in various body systems. Syphilis does not discriminate. One of the ways it can show itself is in the cardiovascular system and the heart specifically. This damage results from damage the bacteria causes to the small arteries in the aortic wall. This weakens the fibers in the wall and puts patients at risk for aortic distension and rupture, which is fatal, very quickly fatal. This same disease process can damage the aortic valves, resulting in insufficiency of blood flow and heart failure, which can also be fatal. Another way that tertiary syphilis makes itself known as is gumas. These are painful, swollen tumors that develop in the liver and skin. You can see a guma on someone's forehead in figure 3. They can also show up in the bones and cartilage. So these tumors are usually benign, but they can impair function. So they do have an adverse effect on the person, even though they are not typically malignant. Another way syphilis shows up in this late stage is neurosyphilis. This is probably the most famous of the tertiary syphilis kind of ways it can show up. Syphilis has a particular affinity for the blood vessels in the brain, cranial nerves, and dorsal roots of the spinal cord, but it can show up in any area of the nervous system. So this causes extremely varied symptoms as a result of its indiscriminate nature in the nervous system. Such symptoms can include severe headaches, convulsions, atrophy of the optic nerve, blindness, dementia, and changes to pupils. So these are varied symptoms. People generally might not think that they have syphilis. I mean, severe headaches could be almost anything, blindness, dementia. It's difficult to attribute these to syphilis. So even if you get to this point, you still might not know that you have syphilis. And then finally, an unfortunate way that syphilis can manifest is congenital syphilis. So this occurs when a woman has syphilis and becomes pregnant. The bacteria T. pallidum can pass through the placenta and be carried throughout the fetal tissues. So it can be transferred from mother to child. It can cause in utero symptoms such as inhibition of fetal growth and critical development, and it can even cause spontaneous miscarriage. If the baby is born, they can show signs of their syphilis infection, such as skin eruptions, bone deformation, and nervous system abnormalities. And then later in life, syphilis makes itself known by causing problems in the bones, eyes, inner ear, and joints. So it is a lifelong disease for a child who was born to a mother with syphilis. The specific bacterium that causes syphilis is Treponema pallidum. It is a small, thin, regularly coiled spirochete. It is gram-negative, and it is an obligate parasite. It is not capable of living outside of a host cell. A host cell is required for its reproduction. And some virulence factors of T. pallidum. First of all, it does not have many of the common virulence factors we associate with pathogenic bacteria. It does not have a capsule. It does not have an M protein. It does not have fimbriae or enzymes. These are kind of the things that help many microorganisms get past our immune system. What it does have is a distinctive hooked tip. This allows it to anchor tightly to mucous membranes or abraded skin and begin to multiply there. A very unique feature of T. pallidum is that its outer membrane contains hundreds fewer membrane-spanning proteins than the outer membranes of typical gram-negative bacteria. This is a property that has been linked to the ability of syphilis to maintain a chronic infection for years. The fewer membranes allows it to appear as if it does not contain proteins or antigens, which allows it to go undetected by macrophages and other phagocytes and kind of fly under the radar for years. Those few rare outer membrane proteins that do exist on T. pallidum are known as TROMPs. So that's a very specific, unique feature of syphilis, and its other virulence factors are still being studied. So as far as the pathogenesis of T. pallidum, it uses that distinctive, specialized hooked tip to anchor to the epithelium at a mucous membrane or abraded skin. It then penetrates the capillaries nearby, and this occurs within the first few hours. So it is a very quickly moving infection, although it does take 3 to 6 months to progress to the secondary stage. It begins that progression very quickly after initial infection. So after it penetrates the capillaries nearby the site of entry, from there it moves into the circulation, and syphilis affects almost all tissues in the body, so when it's in the circulation, the whole body is affected. So for epidemiology, there was a time in the United States when syphilis was so common that large medical centers had entire departments of syphology devoted to detection and treatment. So it's clear that this was a very serious, very scary disease for a long time in the first part of the 1900s. And then penicillin was discovered and began wide distribution in the late 1940s. So you can see in figure 5 that there is a significant drop in the incidence of syphilis in the late 1940s and early 1950s. Specifically, the incidence dropped from 66.4 cases per 100,000 in the year 1947 to 3.9 cases per 100,000 in 1956. So that's a pretty incredible drop thanks to penicillin. However, during the mid-1980s, when the use of IV drugs and crack cocaine kind of skyrocketed, the decrease in syphilis, unfortunately, was reversed. So you can see this in the figure as well. In the late 1980s, just before 1991, there's a little spike there. This is likely due to the fact that when there's more drug use, it also comes with an increase in the exchange of sex for drugs indiscriminate or anonymous sex, and a greater number of people with multiple sexual partners. So from 1986 to 1990, the rate of syphilis nearly doubled, reaching a peak of 53.8 cases per 100,000 in 1990. So that's almost as high as it was before penicillin. And then it went back down again in around 2000. It was at an all-time low, with rates falling to 2.1 cases per 100,000. So this is due to increased awareness, aggressive screening, and emphasis on primary prevention, such as using condoms, dental dams, overall just practicing safe sex. Is what contributed to this. It really was right on the verge of eradication here, thanks to the efforts of organizations like the CDC. And then in present day, the number of syphilis cases in the United States has been on the rise, unfortunately. From 2005 to 2013, the number of primary and secondary syphilis cases reported each year in the U.S. nearly doubled. So in a period of only 8 years, number of cases doubled. Most of this increase, interestingly enough, has been noted in men, as you can see in Figure 7, particularly noted in men who have sex with other men. So this Figure 7 shows that 52% of cases in 2017 were among men who have sex with other men. In 2013, that percentage was as high as 87.3%, so that's pretty shocking. Rates have increased in all racial groups in the past decade, but Black and Hispanic men have an overall higher rate than other groups, and the highest overall rate was in the Western United States. So you can see in Figure 6 that shows those figures. It's very prevalent still in the South, which it has been prevalent there for the past 50 years, in states like Florida, Louisiana, and Georgia. But you can also see a high amount of cases in California and Nevada. So in 2017, the rate jumped 10.5% compared with 2016. So it is very much on the rise currently, which is unfortunate. This is likely due to people kind of forgetting about all the education that happened in the early 2000s. Luckily, syphilis is fairly easily diagnosed using a variety of tests. It is too small to be viewed with a bright field microscope, but it can be visualized and definitively diagnosed using dark field microscopy. So the way this is done is taking fluid from a suspicious lesion and viewing it under a dark field microscope. You can see that characteristic regularly spiraled spirochete. The most common test by far is a blood test. These are based on detection of antibody formed against T. pallidum rather than detection of the bacterium itself. The best blood tests are specific for what's called treponemal antigen. This is a subset of spirochetes, particularly pathogenic spirochetes. So that is the most specific blood test possible. It's the best one you can get. And then finally, another final test you can do is known as FTA-ABS, which is short for fluorescent treponemal antibody absorbance test. So this is kind of, if you want to go above and beyond, this is how you diagnose syphilis. It's, you can't argue with it. First, the test serum is allowed to interact with treponemal cells like T. pallidum. Then it is reacted with anti-human globulin antibody that's marked with fluorescent dyes. So this fluorescent antibody is specific for human antibodies. That's what it binds to. So if human antibodies to treponemal cells are present, they bind to those treponemal cells. Then the fluorescent antibody binds to the human antibody, and the result is highly visible with a fluorescence microscope, as you can see in Figure 8. Those are bright green T. pallidum bacteria that have been marked with that fluorescent antibody in a fluorescent treponemal antibody absorbance test. So this person definitely has syphilis and can begin treatment at this point. So that treatment, throughout most of history, treatment for syphilis was a dose of mercury or a mercurial rub applied to external lesions. Mercury, of course, is highly toxic. This treatment was toxic, unpleasant, and ineffective. So thankfully, penicillin became widely available in the late 1940s, and it replaced all other treatments. Penicillin G remains the treatment of choice to this day. So it is usually injected intramuscularly in large doses. The goal of this is maintaining a blood level of penicillin that is lethal to T. pallidum for at least 7 days. So there needs to be a large amount of penicillin in your system for at least 7 days in order to successfully cure this infection. The way penicillin G works is by inhibiting and breaking down the bacterial cell wall. So it inhibits bacterial cell wall synthesis by binding and inactivating proteins present in the bacterial cell wall, and it also inhibits the transpeptidation reaction of the cell wall, which both of these combined result in lysis of the bacteria and death of the bacteria. So as far as prevention, the best way to prevent syphilis is safe sex. Using a condom, using a dental dam, talking to your partners, making sure your partners have been tested recently, just like the way you prevent any other STD. The easiest way to prevent the spread of syphilis in a population is regular testing. So regular testing every 6 months combined with safe sex practices should greatly inhibit the spread of syphilis. And then, unfortunately, there is no vaccine yet. However, research shows that protective immunity does occur to syphilis in humans after infection. And this is exciting given that it indicates the possibility of a vaccine in the future. So hopefully syphilis will be gone for good someday soon. So here are my references that I used for content in this presentation, followed by images references. Thank you for listening.